Okay, welcome all again to our critical time intervention training for cohort 3 CTI teams. So here's our agenda for our training today. We'll do a brief overview, talk about the data submission protocol. We'll do a live demo in REDCap, talk about some next steps, and then some time at the end for technical support and Q&A. So again, our OMH Office of Population Health and Evaluation is working closely to develop the data collection process for CTI teams in New York State. We are collecting data already from the CTI Cohort 1 and 2 teams. Data is being collected through a data collection platform in order to identify gaps, linkages, and outcomes for individuals enrolled in CTI. The CTI teams will be provided a template of the data items required for manual reporting. And then once data elements are incorporated from that Excel into EHRs, our team will also begin meeting with CTI teams to explore potential interoperability solutions. So all applicants must have an electronic health record or an EMR, so those data elements can be incorporated into those. Each provider should develop and maintain a procedure that ensures timely entry of the information by CTI teams. So in REDCap, this data will be submitted on a monthly basis, and we'll talk more about that process. And then providers are required to maintain accurate reporting and case records according to the CTI program guidance, which we have linked here for reference. So what information will be submitted? CTI teams are required to submit, again, on a monthly basis to OMH regarding all individuals referred to them. And this will include information, but not limited to pre-CTI outreach and encounters, completed referrals. If there's a reason for denial of referral, that will also be included. Admission information, discharge information, characteristics of individuals served, diagnoses, services provided, disposition, community networking efforts, transition between stages of CTI, all referrals, and then monthly status updates. There will also be information submitted regarding performance indicators demonstrating individuals' continuity of care has been assured, including stable housing and reliance on psychiatric center, inpatient and emergency department services has been reduced, and jail or prison time is decreased. So for the actual data submission process, again, we'll be using a tool called REDCap. It stands for Research Electronic Data Capture, and REDCap is secure and HIPAA compliant, so it can be used to collect any type of data in any environment. REDCap is specifically geared to support online and offline data capture for research studies and operations. To use REDCap, CTI teams will need to identify at least 2 staff. So we recommend a primary and backup person at the minimum to submit data into REDCap. And these user accounts will need to be created for the users who will be responsible for the data submission in REDCap. So for that primary and secondary data submitter information, we require name, title, email address, and phone number. And then once that account is created, the user will need to confirm once they've been able to successfully log into REDCap. And that's because there's sort of a 2-part process. Once you've successfully logged into REDCap, that is when our team can then assign you as a user to your specific CTI team and what we call a data access group. So that will allow you to submit data for your specific CTI team. And so we'll get that appropriate assignment confirmed after you've logged in. If there are any updates required to the persons that are responsible for data submission, you can always contact our Data OV help desk and provide the new contact information for that data submitter. So that will just include that information, including name, title, email address, and phone, and then we can get those updates completed. So this is just an example of the user import template Excel that can be submitted with the information required for user accounts in REDCap. So The username, you may have a REDCap username already if you've worked in REDCap, and you can include that in the form if applicable. If not, then we will assign you a REDCap username. Then you will just need to provide, again, first name, last name, email address, your institution ID and CTI team name, your job title, and then we will pre-fill out the sponsor username as the Office of Mental Health, New York State. Expiration will be pre-filled as not applicable. Comments will be pre-filled, need this account for submitting CTI data, and then the final piece of information is your phone number. So once that information is collected on the Data OFI Help Desk, we can create that user account or make updates to an existing user account. Now I'll talk about when the data should be submitted. So data should be submitted on a monthly basis in REDCap. There are different surveys that we'll look at once we do the live demo, but the data that will be submitted is in regards to referral, admission, and discharge, and that data will need to be submitted within 30 days of the client's referral, admission, or discharge dates. And then we have encounter and monthly status data submissions, and those will be based on the previous month's encounters and will need to be submitted by the 15th of every month, or the next business day if the 15th falls on a weekend or a holiday. So for example, any services that were provided beginning November 1st through November 31st, data submissions in REDCap are due by Monday, December 15th. We do have reminder emails that are sent out at the beginning of each month, just to remind data submitters that the previous month's data entry deadline is coming up. And then we also do data validation. So our OFI team monitors the data submissions in REDCap, and after the 15th deadline every month, we will reach out to any teams who may not have timely reports or for any data that is irregular or we may just need additional clarification on. So we will provide those data validations as well. So now I will switch over to the REDCap. While I'm doing that, are there any questions before we get into the live demo? Okay. So this is REDCap, and this is in our testing, dev, and QA environment. So your login may not look exactly the same as this, but this will give you a good idea of what the surveys will look like when you do have REDCap access. So when you are in REDCap, you will have a list of projects and you will see your critical time intervention, your CTI project. Once you go into that, you can go to edit and add records. That's where I am currently. You'll have the option to select your CTI team name, and then you can add a new record. When you click to add a new record, you will begin with the CTI referral data collection instrument. And then you can see, depending on your responses in the CTI referral, you will then have access to the CTI admission, CTI encounter assessment, CTI discharge, and CTI monthly, depending on how you complete this CTI referral form. So I can see this status is incomplete currently. I haven't opened the instrument. I haven't saved any data. So we'll open that first. You'll see in this survey, we start with the CTI team details. This information will all be pre-populated for your CTI team. Currently, this looks a little bit differently because I am in that dev QA environment, but you won't have to worry about entering any of those CTI team details. The next section will be CTI team contact information, and this will be contact information for who any external providers and service agencies can contact from the CTI team to support care coordination for this client. I will fill this in to show you that on the next survey that I need to complete, this information will also be pre-populated in those ongoing surveys. So I will add some fake information here. Okay. And then next we have the recipient characteristics. And you'll see that on any of the fields that have a red asterisk, those need to be completed before moving on in the survey. So if these are not, you will get a message in REDCap notifying you that there are fields that must be completed before continuing. So I will put in some information here just so we can move on to the next survey. So after the recipient characteristics, you'll see this referral section. And all of these fields within the referral must have a response included. So we ask for a referral source, and for some of the information, such as hospital inpatient, there will be additional follow-up questions that will be required to answer. So if the referral source, for example, is hospital inpatient, we do also ask for the hospital inpatient specific name. So we have a drop down available with the hospital information. You can select the hospital name, and then going on to the referral date, and then the first point of contact date with the client. And then next, will the individual be receiving pre-CTI services pending enrollment? So yes or no, depending on what's applicable. And then was the individual admitted or enrolled in CTI services? If I select no, the individual was not enrolled, you will need to select the non-enrollment reason. So we have a drop down of applicable non-enrollment reasons that you can select. If the individual was admitted or enrolled in CTI services and yes is selected, REDCap will let you know that you can save and continue onto the CTI admission form. And in order to add data to the CTI admission form, you must answer all of the required fields on this form, so anything with that red asterisk. And then you must change the form status to complete. So currently, the form status is incomplete. If I switch this to complete, I'll be able to save an exit form or save and go to the next form, which will then bring me to that CTI admission form. So I will click that. Okay, so now I have the CTI admission form open, and you can also see on the left here the data collection instruments that I'm completing as I go along. So currently I'm in that CTI admission. I see that for the top section, my CTI team details have carried over along with that CTI team contact information. If nothing has changed for this CTI team contact information, you're okay to just leave that pre-populated information here. If there are any updates to who external providers should be contacting to support care coordination for the client, that information should be updated in this admission form and then saved once completed. So moving on to the admission date. So this is the admission date of enrollment into the CTI program. So I can say today, for example. That recipient information carried over from the referral form as well. We have information for benefits and insurance, a section for diagnoses, and I'll just point out for the primary psychiatric diagnosis and any additional diagnoses, as you are typing, there will be fuzzy logic, so the drop downs will appear for anything applicable, and you can select the diagnosis. Um, You can also add additional diagnosis. Maybe there's 3, you can add up to 5. So I can continue to click to add additional diagnoses here. And then same thing, as you're typing, the information will be available in the dropdown to select. Then we have the comorbidities and chronic medical condition sections, and these are very similar where you will see each comorbidity listed, and then we'll select no, yes, or unknown for those. And then we ask about linkages, ER visits and hospitalizations, and arrests and incarcerations. So you can see for the ER visits and hospitalizations and arrests and incarcerations, you'll enter the number of visits, whether that's ED visits, inpatient visits, or psych inpatient bed days. You'll enter that number for the past 6 months and then in the past month. Same thing for arrests and incarcerations. There is information asking about parental status and housing. Suicide risk questions, and then social determinants of health. So at the end of the admission form, you'll see a similar note. So in order to add data to the CTI encounter, discharge, and monthly forms, which are the next 3 forms that you would complete, you must answer all required fields on this form and change the form status to complete. So again, REDCap defaults this to incomplete. If I come to this drop down, mark as complete, and then save and go to next form, it will open up that CTI encounter assessment for me. So for any CTI encounter, you would want to enter a individual encounter for that date of service. So if someone had 5 different encounters over the course of 5 days, each date of service would be entered individually in here, and then I would have 5 total CTI encounter assessments entered. So that recipient information, again, will carry over to the encounter assessment, and then you will fill out the information accordingly. So because I said that this client was not enrolled in pre-CTI services and they were just enrolled right into the CTI program, this encounter assessment is a CTI encounter. If for some reason I need to update that to a pre-CTI enrollment encounter, maybe I ended up doing pre-CTI services prior to their enrollment in the CTI program, I can update that here. I can add the date of service today, the contact type, modality of contact, location of client during contact, the targets involved, and then the length of contact. And lastly, the type of CTI service. So because I have CTI encounter selected at the top, I see all applicable CTI encounters here. If this was a pre-CTI encounter, then I would have that additional option to select pre-CTI enrollment or outreach from my type of pre-CTI service here. And then similarly, I just need to change this form status to complete, and then I can save and go to the next form. So the next form, if I don't have any other encounter assessments to enter, will be the CTI discharge form. Again, those CTI team details carry over along with the recipient information. If I had entered a client Medicaid ID for this client, that would have carried over as well. And then the first new section on the discharge form is the discharge information. So I will enter the discharge date, the discharge reason, and then discharge disposition. So the next sections should look a little familiar because they are part of the admission survey, and the same sections for linkages, benefits and insurance, ER visits and hospitalizations, arrests and incarcerations, parental status and housing, suicide risk, and then social determinants of health are asked again on the discharge form to see if there have been any changes to that information from when the client was admitted into the program. And then after completing the discharge form, you will update the status to complete and then save and go to next form. So before I completed the discharge form and after I entered some of those encounter assessments, there is the CTI monthly survey, and that is something that you will have to come in and update on a monthly basis for the duration that the client is in the CTI program. So prior to discharge, if I'm working with this client for 2 months, I would expect to have two completed CTI monthly surveys, and I can come to this section here and click on that CTI monthly. I see that I am on the first current instance of a CTI monthly survey. I will add the date of that monthly status. The CTI team details and recipient information are pre-populated. The CTI team contact information will need to be filled out again. So I'll just do that. And then you also have those questions for linkages, ER visits, and hospitalizations, arrests and incarcerations, housing, etc. One thing to note about the monthly surveys is that, let me just click some information here. I'll add in some information here so you can see when I let me update this to complete and then save and exit form. And if I want to add an additional monthly survey for my second month working with the client, I can do that. And I can come to this CTI monthly, add an additional survey. It will let me know this is the second instance, and this is a new survey that I'm completing. I will add the date in there. I have the CTI team contact information carry over from that first monthly survey. And I will also have any information that I completed from that first monthly status survey in any of the ongoing instances. So whether this is the second month, third month, fourth month that I'm adding a monthly survey, this information will carry over from the first survey to make it a little bit easier to make any updates. So if none of this information has changed, I will read through, confirm, make any updates as needed if there have been any changes to those details, and then I can mark this as complete and save and exit form. So now we see in my CTI monthly status, I have two different instances completed for the first and second month that I've been working with the client. So those are all of the data collection instruments that will be completed. Any questions on that so far? Okay, I will show you one other item that we have in REDCap that is very useful. Um, in our reports section here on the left navigation menu, we do have a new report for active clients. So if I click on this active clients report, again, this is in our dev QA testing environment. So these are all test records that have been entered. There is no client information here. When I go to the active clients reports in REDCap, this will show me all of the active clients that are part of my CTI team. So you can see it's returned a total number of 42 clients out of a total number of 152 records that were queried. So this active clients report, there's some details about what is included in the criteria. So the below list will show only currently active client records, meaning that the following records are excluded from the report. So we will not see any client with a completed discharge form, and we will not see any records that indicate the client is not admitted on the referral form for any reason other than begin pre-CTI enrollment or outreach services. There are live filters that you can apply to the active clients report here, and those are located at the top. So if you see the live filter question, it's was the individual admitted or enrolled in CTI services? If you click this drop down, you can select yes or no, depending on what you want to see. So for example, yes, I want to see only active clients that have been admitted or enrolled in CTI services. I see that filtered my number of results down to 35. And then in this table, I see all of those clients currently admitted to CTI. If I were to select no, I see that has updated my report to only 7. And now I'm seeing only clients that are currently receiving those pre-CTI services. So this report can be helpful because if you are entering many different clients into REDCap, you will see all of those records in a long list of, for example, 152 records. So this is a nice way to be able to filter just for those active clients and some additional live filters that you can apply. This table below can also be exported. So you can export that, you can print that for reference. Any questions on the active clients report? Okay, well, I will go back to the PowerPoint that completes the live demo of the survey instruments, and we'll talk a little bit about next steps. It's a little bit slow, but hopefully we can move on to, okay. So now we are on our interoperability planning. This is part of our next steps. So again, while data is being submitted manually into the REDCap, CTI teams are encouraged to work towards the interoperability solution so that data can be pulled directly from EHRs. At the time that the pull from EHRs is completed, then the manual reporting in REDCap would no longer be needed. So to get to that point, CTI teams can begin reviewing the CTI data dictionary, which we will provide along with other materials after this training. And that should be reviewed with your EHR vendors so that your CTI teams and EHR vendors can identify which data elements may already exist in your EHR, and then which data elements from the CTI data dictionary still need to be added. Once all of those CTI data elements are added to the EHR, then we can confirm that everything is captured as expected, and CTI teams and your EHR vendors can start working with our Data OFI help desk, and we'll begin scheduling technical sessions and talk about milestones that can be established to work towards interoperability. So we have our Data OFI help desk information here. You can always reach out with any questions regarding the CTI data dictionary or adding those elements to your EHRs, but we do want to confirm that all of the data elements from that Excel data dictionary that will be provided are incorporated into your EHR prior to any of the technical sessions beginning. So for next steps in terms of REDCap data submission, CTI teams will complete the CTI REDCap user account Excel and send to Data OFI for REDCap CTI account creation if your teams haven't done so already. So again, each team must have at least 2 data submitter contacts, 1 primary and then 1 backup person. We do recommend additional data submitters, more than 2 if there are larger teams, to ensure maximum coverage. And then each user will receive an email from NISP REDCap with their REDCap account and login information. Once you receive that, users must email the OFI Data Help Desk to confirm that they've successfully logged in to REDCap. And again, that is just because once you are granted account access in REDCap, you do need to log in prior to us being able to add you to your specific CTI team in REDCap. So once we get that confirmation, you've logged in, we can have NISP assign your user details to the appropriate CTI team. Data submissions can begin in REDCap as soon as your team is live and your account is created in REDCap. So again, what those submissions will look like, we'll have the referral, admission, and discharge data that needs to be submitted within 30 days of that client's referral, admission, or discharge date. And then the encounter and monthly status data submissions are based on the previous month's encounters. And those will need to be submitted by the 15th of every month or next business day if the 15th falls on a weekend. So again, those encounter submissions, there will be an encounter for every date of service with that client. And then the monthly status submissions, there will be one for every month that you have worked with the client. So I will share some of our technical support information. So again, we have our OFI Data Help Desk, and you can email that help desk for any data-related questions, technical support, requests for updates to the data submitter information. That email is dataofi@omh.ny.gov. And then we do just request that you include CTI or critical time intervention data submission in the subject line of your email when contacting that help desk. We are working on many different data collection projects, so including that in the subject line will ensure that we can get your question routed to our appropriate CTI team. And then for any questions about client level data, please just only include the record ID number that you will find in REDCap. You do not need to include any client identifying information. We want to make sure that the emails sent are secure, that they do not include client information, and we'll be able to determine the client that you are referencing just with that record ID number. One final note, please do not email NISP or REDCap. This is not monitored by our OFI Data Help Desk, so it is best to just email the OFI Data Help Desk directly. And I'll show you, sometimes that looks like this link in REDCap. It's very convenient, but it will not contact us directly. So don't use this, just email Data OFI Help Desk and we'll be able to answer your question very quickly and route that to the appropriate team. So that concludes all of the notes that I wanted to share. Any questions or anything that we can go back and review? Oh, I see Jordan has a hand raised.
I was just curious if you have a list of EHR vendors that are already integrated into REDCap so we could check to see if ours is on there from cohorts 1 and 2.
Yeah, so we haven't started the interoperability technical discussions yet with cohort 1 and 2, but we do have some of their EHRs confirmed already that their CTI data elements are incorporated. So I think if you want to email our Data OFI help desk, we can, with the name of your EHR, we can confirm if any other of the CTI teams are working with that same EHR vendor, if that's helpful. Hi, Samantha.
Hi there. Couldn't find the unmute. So could we go back to entering additional information on a client who's already been entered in the system, right? It's
Mhm.
the second month. and we want to enter those engagement events, we would go to the active client report and then use that list to then find that specific client.
You can go to the active client report to find that client. And then, like you're saying, if you click their record ID, for example, it will open up the where you left off on. But you also have the option to go to the record status dashboard, which has all of those record IDs and client names. You can also go to add or edit records. And then this would be where your CTI team name is, and you can search for that record here using any of the search text.
Okay.
And then those would be listed. This is just a little bit different because I'm in our testing environment, but they would be listed here once you add your CTI team name.
Okay. Wonderful. Thank you.
You're welcome. And then I think maybe we've gotten something in the chat. Let me.
Hey, Melanie, that was just me responding to
Oh,
Jordan.
okay.
He had lost power, so I was just reiterating basically what you had said.
Oh, perfect.
I have a quick question. This is Katie Diebel from Jewish Family Services. You had mentioned the CTI REDCap user account Excel sheet. Has that been sent to us yet? I just want to make sure I haven't missed anything of needing to fill that out and return it.
No, you have not missed anything. So we will send that out to you along with the slides, and we'll also provide the recording. And we do have PDF versions of each of those individual surveys that you saw. So we'll provide all those materials to you. Any other questions? Okay, well, if anything does come up, please feel free to reach out to our Data OV help desk at any time. And again, we will be sending all of the data submission materials to all Cohort 3 teams today with the user import template so that you are able to add REDCap users or update REDCap users if you've done that already. And I guess I'll turn it back over to Craig or Melissa if there's anything else that we want to touch base on with our remaining time.
Thank you, Melanie. Yeah, I just wanted to thank you for providing this training on Webex here. And we have this recorded, so we'll be sharing that with the other information you'll be sending out. If anyone has any other questions, like Melanie mentioned, feel free to reach out to the OP help desk as well. Now or in the future, any related questions to data entry or REDCap. So thank you, Melanie, for hosting us today. And if there's no other questions, I think we're all set.
I think I just saw one.
Yeah, you got it, Melanie.
Oh, we got one more?
Yeah, from Amanda. Thank you. So Amanda asked, is there ability to test the REDCap usage before we go live so we can test and train our folks? Unfortunately, we don't have a dev QA environment for our REDCap end users for the CTI teams, but we do have those PDFs that will give you a pretty good idea of all of the questions that will be included in the REDCap. And REDCap is pretty forgiving. You can enter information in the survey once you do get access, and you can keep it as incomplete. So if you need to make any changes before completing that survey and moving on, you can do so. And then if there are any data entry errors or things that you want clarification on, you can always reach out to our Data OFI help desk, and we can definitely assist before anything is submitted. All right.
Any
I think
other
now
questions?
that's all the questions.
Okay. Thank you again, everyone, for joining, and thank you, Melanie and Kristen from OFI.
Thank you.
Have a good day, everyone.
Have a great day. Bye.
Thanks. Bye-bye.